One of the biggest problems I see when it comes to dealing with arthritis is usually the advice you get for that arthritis. Hear me out. So let's say you've got knee pain. You're over the age of 40, or maybe you're in your 60s or 70s, let's say, which there's a really good chance, I'd say a 99% chance that you've got osteoarthritis in your knee when you have reached that decade of life, okay? The science tells us, and it's just kind of the evolution of life. But just because you've got knee pain, and just because you're in your 60s, and just because an x-ray said you have arthritis, does not mean that arthritis is actually your problem, okay? Because what typically happens is if you've been told you've got arthritis in your knee and that's why you think you're having terrible knee pain, and then someone tells you, okay, well, you should rest or you should stop doing the thing that is bothering your knees. You've got bad knees now because of arthritis, etc., etc. Let's get a cortisone shot to help with the pain in your knee because of the arthritis. This type of advice is not the best way to manage arthritis, okay? First, you've got to make sure your knee pain is actually from arthritis. That's the number one thing I see go wrong when it comes to managing arthritis, especially of something like your knee. I'm talking about the knee because your knee is where most arthritis shows up. The most common area in your body to have osteoarthritis is in your knee. I'm talking about osteoarthritis, not rheumatoid arthritis or an inflammatory type of arthritis. That's a different conversation. We're talking about osteoarthritis. Your knee is the most common place to see it, but it can be anywhere, in your spine as well. First, you want to make sure that arthritis is actually the reason for your pain, because like I said, everybody gets arthritis, everyone, okay? But not everyone with arthritis has the same amount of pain, okay? We'd all be walking around, hobbling around in our 60s and 70s and 80s if everyone who got arthritis also got terrible knee pain. Does that make sense? We know this is true because of x-ray studies, right? So people x-ray and MRI studies. They've done studies on images of people with no knee pain. They've done several studies like this where it shows that 60, 70%, 80% of people in certain age groups have arthritis on imaging, but these people are walking around with no knee pain. So that's how we know just because you've got arthritis doesn't guarantee you're going to have pain. So that's number one, okay? So you got to take that word with a grain of salt. It doesn't mean it's the end of your life. It doesn't mean you have to stop all the things you love to do. Now, there are cases where you've got arthritis and you've got pain that corresponds with the arthritis, okay? If that's the case, you want to also be careful of what type of advice you take, because here's the thing. Arthritis responds best to movement and exercise. So yeah, your joints might stay stiff, but we can live with some stiffness. But when you've got debilitating pain, no, you've got to make some changes. So the right type of movement is actually going to help your arthritis. Not doing anything, resting, and avoiding lots of activities is going to hurt you more than it will help. The other thing is if the arthritis is really bad, and usually what's causing the pain is something we call bony edema. Basically, it's swelling like inside the joint, like because your bone is actually like living tissue. So it's swelling in that area of your knee. So there's a couple ways to get rid of that. Sometimes movement on its own will kind of get things moving, fluid in your body so that you can kind of get rid of that inflammation. Our bodies are designed to rid inflammation by themselves. But sometimes that doesn't happen because especially if you're older, your metabolism slows down, just our ability to heal, it's slower. Okay, it just slows down, and sometimes you need a little help depending on what's going on. So many factors are involved here. Sleep, nutrition, your diet, everything. This is where, full body health really comes into play. What a lot of people do is they get cortisone injections. Now, here's the thing. Something like a cortisone injection will most likely zap the pain away, but it'll come back, okay? Because number one, it's not a natural way to heal. It just kind of masks the edema and the pain that's happening in your joint, and it doesn't do anything to actually help that actual process of ridding the inflammation. So instead, what I advise is using something like what we have in our office, shockwave therapy, combined with EMTT. Those two treatments together will actually bring blood flow, stem cell proliferation, all the good things in your body that are designed to heal and kind of get rid of that inflammatory process. That's a natural way to do it. You're not going to have any of the bad side effects of cortisone, which if you keep getting cortisone shots, especially especially in a joint like your knee, it's going to fast track your road to total knee replacement. So if that's something you're trying to avoid, I definitely don't recommend cortisone shots. So these are just some of the things that I hear over and over again from some of our clients who come in complaining of arthritic pain. Now, I'm talking a lot about the knee joint just because if you've got arthritis and you're listening to this, there's a good chance you have knee pain because that's the most common area of your body to get osteoarthritis. But it can happen anywhere, and this advice still applies. So first, number one, make sure arthritis is the reason for your pain. You probably have arthritis, but it doesn't mean it's the reason for your pain. So number one, get checked out by a mechanical pain expert who knows how to rule these things in and out and can tell you exactly where your pain is coming from. This goes for any joint, not just your knee. Number two, if you've got arthritis, you want to approach it properly and in a healthy way. So movement is good, okay? And then if you are having terrible pain, look for natural ways to subside the pain or get rid of the pain versus like pills or cortisone injections, okay? That's kind of my tips for today in terms of dealing with arthritic pain. Make sure it's actually coming from your arthritis, and then choose natural, healthy ways to mitigate your pain. And of course, ask for help, right? If you're local and listening to this, come talk to us here in Portsmouth, New Hampshire at CJ Physical Therapy and Pilates. We would love to help you. We help tons of people just like you get rid of pain because of their arthritis.